So our demo group is the mechanisms of respiration. I'm Ashley.
I'm Aubrey.
I'm Emily.
Catherine.
Yep, hi, here I am.
So there are different kinds of costovertebral joints. So the first one is the costovertebral joint, which is where the head of the rib articulates with the thoracic vertebrae. And then the costotransverse joint is where the tubercle of the rib articulates with the transverse processes of the thoracic vertebrae. So these help with thoracic stabilization for any load bearing or mobility. They also protect any of the nerves and anything in the spinal cord, and then the chest wall movement is easier and there's respiratory effort.
Okay, so the costovertebral joint. So this is the head of the rib articulates with, it's going to be this top picture, so the superior costal facet of the corresponding vertebrae, which that's going to be right here, and then the inferior costal facet of the superior vertebrae, that's going to be right there, and then the intervertebral disc separating the two vertebrae, so that's going to be that gray portion right there. And then for those, there are ligaments that help stabilize them. So we have the intra-articular ligament of the head of the rib. So that's going to be this, shown in this picture right here. It attaches the rib's head to the intervertebral disc. And then we have the radiate ligament of the head of the rib. So that's going to be right here. And then it fans outward from the head of the rib to the bodies of the two vertebrae and intervertebral disc. Kind of out of breath from doing that. So next we have the costotransverse joint. So that is the tubercle of the rib that articulates with the transverse processes of the thoracic vertebrae. So this is going to be our thoracic vertebrae. As you can tell, it kind of looks like a giraffe. And then out here it's kind of hard to see, but that is going to be where the thoracic transverse processes lie. So then there is 3 ligaments for this. The first one is costotransverse ligament, and that is going to be shown here. That connects the neck of the rib and the transverse processes together. The next is going to be the lateral costotransverse ligament. That extends the transverse process to the tubercle of the rib. And then lastly, we have the superior costotransverse ligament, which is going to be shown down here or here. And that passes from the upper border of the neck of the rib to the transverse processes of the vertebrae superior to it. Okay, so I'm going to be talking about the costovertebral joint on the skeleton. So it's going to be kind of hard to see, but we're going to look at this one right here. So this is the costovertebral joint. Here is going to be the inferior costal facet. Here is going to be the superior costal facet. And then right here is going to be the intervertebral disc, which separates the two vertebrae, and it also connects there. Okay, so next we are going to be talking about the costotransverse joint. I'm just going to point that out on the skeleton. So that is going to lie right here between the ribs and the transverse processes of the thoracic vertebrae.
Okay, so next we're going to talk about the muscles of inspiration. The diaphragm is the main muscle of inspiration, and it contracts to expand the thoracic cavity. The external intercostals also help force inspiration, and they contract to elevate the ribs to expand the thoracic cavity. And then accessory muscles to that are levators costrum longus and brevis, serratus posterior anterior, the scalenes, the pectoralis minor, which contracts to pull the ribs outwards, which would lie inferior to the pectoralis major seen here. And then the sternocleidomastoid contracts to pull the ribs outwards, which you would insert right here and go up. And then we actually also have a diagram of the diaphragm. So how the diaphragm works is when it's relaxed, it's up into the thoracic cavity. And then when it contracts, it goes downwards into the abdominal cavity and increases the negative pressure, expanding the ribs.
Okay, next we have the muscles of forced expiration. So during quiet breathing, expiration is passive, and that is due to the diaphragm, which relaxes and reduces the pressure within that thoracic cavity. But during forced expiration, the internal intercostals are the main muscles there, and they cause expiration by contracting and pulling the ribs down. Next is the latissimus dorsi, which also is an accessory muscle to expiration, along with the serratus posterior inferior. And a couple other accessory muscles are the abdominals, which contract to pull the abdomen or to compress the abdomen, and the quadratus laborum, which contracts and pulls the ribs down as well.
And that's our presentation.